Coming to question 37, this is actually a 2024 cardiology question. So yeah, I put it up after 2023 because we had discussed something about murmurs till now. So this question may be useful now. A young athlete comes with chest pain and dyspnea. His brother passed away due to sudden cardiac death. He is suspected to a HOCM. A harsh systolic murmur is heard in the left sternal border. What will increase the amount? So I think the diagnosis is very quite obvious. We had discussed a previous question on HCM also, hypertrophic obstructive cardiomyopathy. So usually occurs in young athletes. They are present with sudden cardiac death. There will be a family history of sudden cardiac death. And we have discussed about the structural findings also, that there will be asymmetrical septal hypertrophy. And the other one finding is there will be systolic anterior movement of mitral valve in echo. Possibility that this may come for a video question. Now when discussing about HOCM, remember HOCM is nothing but hypertrophy of the heart. So it is like more or like aortic stenosis. So likewise, we discussed aortic stenosis will produce ejection systolic murmur of aortic area. This murmur can be heard anywhere, it can be conducted anywhere. Likewise, you remember hypertrophic cardiomyopathy also. It is also like aortic stenosis because there is left ventricular hypertrophy. So in HOCM also there is ejection systolic murmur which is heard. It is heard diffusely throughout the chest. Maybe you can take it as aortic area here also. Aortic area or mitral area, diffusely we can hear. So in both AS and HOCM we get ejection systolic murmur. At the same time, we can discuss another one concept, that is mitral valve prolapse. Mitral valve prolapse is the mitral valve becomes degenerate. It's called as myxomatous degeneration of mitral valve. So what happens is during systole, it becomes lax. The mitral valve becomes lax and it prolapses into the left atrial cavity. When it prolapses into left atrium, there are chances that it may lead to MR. So mitral valve prolapse is like MR. So what does it produce? It produces pansystolic murmur. So MVP is like MR. One additional finding which you hear in mitral valve prolapse is before the valve opens to cause mitral regurgitation, due to the laxity, due to stretching of the valve, we hear a systolic click. Okay, so there is a left ventricular contraction. Maybe you can draw the box diagram here. Left ventricle and left atrium. So this is the mitral valve. So instead of being very stiff, it becomes lax. So it is lax like this already. So when the left ventricle contracts, this valve gets protruded into the left atrium. And because of its laxity, it opens at one point. So at the full laxity of the valve, there will be a click and later this valve will open up. It leads to mitral regurgitation. Okay. So HOCM and MVP are two very important questions for only one MCQ, that is this MCQ. HOCM is like aortic stenosis, mitral valve prolapse is like mitral regurgitation. So what murmur you hear in HOCM? Ejection systolic murmur in aortic area or all areas. In mitral valve prolapse, you can hear pansystolic murmur. Let's not get confused with the areas. We'll just think about the murmur. So that's a pansystolic murmur. Plus a click. Say ejection systolic click. Now the most important question comes about dynamic auscultation. How do you differentiate between AS versus HOCM? How do you differentiate MVP versus plain mitral regurgitation? Answer comes in dynamic auscultation. For these two diseases, HOCM and mitral valve prolapse, they behave similar in dynamic auscultation. Remember the mnemonic vast hand. Vast is big, so Valsalva or standing. Vast, remember it is big, so increases. When Valsalva are standing, murmur increases. Hand, that is hand grip. Hand grip and squatting are similar. Hand grip and squatting are similar. Remember the letter D. D is for decrease. So it decreases the murmur. So we'll write it down here in HOCM and mitral valve prolapse, Valsalva maneuver and standing increases the murmur. And hand grip and squatting decreases the murmur. This is different from other valvular heart diseases because in all other heart diseases, Valsalva increases the murmur. Because on doing Valsalva or standing, what happens? The venous return to the heart decreases, blood flow decreases, turbulence decreases. So, in all other valvular heart diseases, Valsalva will reduce the murmur. In all other valvular heart diseases, doing Valsalva or standing by reduced flow will decrease the murmur. That is the actual easiest physiology. But what happens in HOCM? In HOCM, because there is a systolic anterior motion, when there is reduced flow, the obstruction will increase, right? When there is reduced flow, the left ventricular cavity size decreases further. Hence, murmur increases. What happens in mitral valve prolapse? When there is less blood in the left ventricle, the chance that the chance of prolapse is more. That's why in mitral valve prolapse and in HOCM, Valsalva maneuver increases the murmur. Likewise, in all other valvular heart diseases, hand grip or squatting increases the peripheral resistance. So when the peripheral resistance increases, turbulence will increase, right? Because of the pressure difference. So hand grip or squatting will increase the murmur in all other valvular heart diseases. But in HOCM, what happens? When there is a hand grip, due to hand grip or squatting, when the peripheral resistance increases, naturally turbulence increases. When turbulence is more, flow is more. So the left ventricular cavity size increases. So the anterior motion of the mitral valve gets reduced. So murmur decreases. Similar in mitral valve prolapse. So when there is increased peripheral resistance, there is increased flow across the valve. When the flow is more, it reduces the prolapse naturally. Okay. So even in the last minute rush, if you forget, please remember the mnemonic vast hand. Vast means big. So in Valsalva standing, murmur increases in HOCM and MVP. Whereas in hand grip, there is D, so decrease in murmur in hand grip or squatting. So now coming to this question. Question is simple. They are given a case of HOCM. There is a murmur. Which of the following will increase the murmur? So remember the mnemonic vast. So Valsalva maneuver will increase the murmur. Standing will increase the murmur. So Valsalva is the answer. Hand grip will reduce the murmur. Squatting also will reduce the murmur. Leaning forward is a maneuver which is done in aortic stenosis. So leaning forward increases murmur in aortic stenosis, not for HOCM.